Excuse me, but do you have any health problems?
I often get stiff shoulders, probably because I use the computer a lot. I guess it's because of eye strain. My legs around the knees hurt sometimes. I work standing up, and so I stand about 5 hours every single day.
Back when I used to play baseball, I hurt my shoulder, and it still aches. Living in our stressful contemporary society, it's hard to stay in good health. But did you know that the root cause of all kinds of diseases lies within our nerves? Our brain coordinates the functions of the human body. Stretching from the brain down through the spinal column, nerves spread throughout our entire body. The spinal column is designed to move freely, but when part of it becomes deformed or slips out of position, the bundles of nerves that go through it are subjected to pressure, causing various symptoms. This is how disease can begin. Rather than a hospital or doctor, such diseases can be healed by the natural healing power we are all born with. A wonderful non-surgical procedure has been developed that draws out this natural healing power to the fullest. Restoring the body's balance by restoring the autonomic nerves and motor nerves' unimpeded connection to the brain elevates natural healing power to the maximum. Vital React Therapy is a groundbreaking technique that guides you to recovery. First of all, I'd like you to understand the causes of disconditioning in order to deepen your understanding of the curative mechanism. The job of us therapists is to awaken your natural healing power, because it's this natural healing power inside of you that will heal your disease. You may be surprised to hear this, but many physical problems, including stiff shoulders, lower back pain, as well as serious diseases, are often caused by disorders of the nervous system. First, let's learn a little more about our nerves.
Thanks for joining us today, Dr. Yamasaki.
My pleasure.
Let me come straight to the point. I hear that one of the root causes of various kinds of disease has to do with our nerves. Could you be kind enough to tell us about nerves?
Our bodies are controlled by our nerves. I'm sure you know this, right?
Yes.
These nerves extend from the brain and through the spinal column, reach every part of the body to control every single muscle. The nerves are first formed in the mother's womb. In the womb, the brain is formed first, followed by the spinal ganglion. Then the heart begins beating, and other organs begin to form. Scientific research has discovered that the brain's frontal lobe stores knowledge. The occipital lobe coordinates movement, and the brainstem supports life. There are two major kinds of spinal nerves. Motor nerves move the body according to the thoughts in our brain. Autonomic nerves, on the other hand, operate our internal organs. For instance, our heart beats and we breathe because of our autonomic nerves. The skull and spinal column protect the nerves from being damaged. If the spinal column becomes structurally or functionally abnormal due to injury or other causes, we begin to develop various symptoms. For example, when you kneel on the floor in the formal seiza position, pressurizing your veins and nerves, your legs begin to ache and then become numb and can't be moved. It's just like that. It is said that most physical discomforts, such as stiff shoulders and lower back pain, are caused by compression of the nerves and the resultant poor blood circulation. Even worse, our nerves are always faced with this threat of compression. It starts immediately when you are born. When the baby's head is about to come out, its neck is twisted if its shoulders become caught. If you try to forcibly pull the baby out, you will place a large burden on it, which can lead to wry neck and delivery paralysis. When you become an adult, your spinal column may be deformed if you accidentally fall, miss your footing on the stairs, have a traffic accident, suffer an impact while playing sports, or maintain bad posture. All of these can compress your nerves. We vital react therapists call any part of the body where the functions of the nerves are hindered or obstructed, or where there's some major problem, an interrupter. The way to recovery is to return that interrupted part of the body back to its normal condition. Vital react therapy is administered by using this high-tech equipment called a vital reactor, which consists of a PC and a probe.
So what exactly is vital react therapy?
It's the natural healing power that we are all born with that heals disease. Vital react therapy simply brings out this natural healing power to its fullest.
So it makes the most of our latent power.
Right. The spinal column passes through the center of the human body. Should it become twisted at some point, the bones become rigid as if they were fixed, compressing the nerves that stretch between the vertebrae. This impedes the functioning of the autonomic and motor nerves and suppresses the body's natural healing power, giving rise to various symptoms. Once a bone becomes rigid, it triggers a vicious cycle. The bones above and below will also not move smoothly. To make up for this, bones and muscles in remote positions are then forced to assume an unnatural posture. Vital react therapy works on what is hindering or obstructing the nerve's functions to restore the nerve's functions and return the body's natural healing power back to normal. A high-tech piece of equipment, called a vital reactor incorporating advanced technology, is used to scientifically and accurately perform a non-surgical procedure.
Now let's take a look at how vital react therapy is performed.
This is the vital reactor. It's a piece of high-tech equipment developed jointly by Dr. Yamasaki and Dr. Pierce, a leading chiropractor. Once rigid bones are identified, you apply a probe to them and then apply vibrations of a force and rhythm easily accepted by the human body. We call this process adjustment. The computer monitor instantly displays a graph showing the status of the rigid bones as detected by the highly sensitive sensor. Once the bones are loosened, the probe stops automatically. For face therapy, the probe is applied directly to the skull. Once the adjustment has been performed at all of the locations where the nerve's functions have been hindered, vital react therapy is complete. Our natural healing power is supported by the spinal nerves that run through the spinal column to the brain. Vital React therapy stimulates the interrupter, encouraging the central nerves to reset the spinal column back to the regular position. What happens next is, thanks to the functioning of the brain, the nerve starts working normally where its functions had been previously hindered, returning your body to a normal condition. Vital React therapy is a process whereby the cause of a problem is identified using scientific data, encouraging the patient to understand what's happening in their body so that they may begin drastically improving their health.
Could you please tell us in some detail what the specific steps of the Vital React therapy are?
First of all, you need to realize what way the interrupter, or the cause of the problem you now have, is affecting your body. For this, you need to undergo a designated set of exams. First is a posture check, which we call a mirror check. You stand in front of a mirror with a grid pattern on it to see how your posture is distorted. The purpose of doing this is to let the patient see for himself or herself just which part of their body is distorted and how. Then there is a Massa test.
A Massa test?
Yes, this is a physical exam. You check for physical abnormalities, such as limited joint mobility and excessive muscle tension. As you lie on a bench, we check for differences in which direction the left and right toes point, and in the height of the tips of the left and right toes, if one arm is at a higher position when you raise both arms, and any difference in the results of muscle tests on all four limbs. Next, under the guidance of a doctor, an X-ray is taken. This lets you know what condition you are in medically. Then, using a dermothermograph with a sensitive infrared sensor, the temperature in the middle of the spinal column and at the first cervical vertebra is measured. Body temperature is adjusted by blood circulation under the control of the autonomic nervous system. If an interrupter exists, the autonomic nerves will not function properly, making body temperature adjustment uneven, as illustrated by this shaky graph. So the purpose of all these tests is to verify your body condition.
And now it's time for the procedure using the Vital Reactor, right?
Yes. You recover in stages. The first step is to get rid of the interrupter, namely the cause of your problem. This is similar to when you try to stand up with your legs asleep after kneeling on the floor in the formal seiza position. If you don't try standing up from the floor, your nerves will continue to be compressed, only aggravating the symptoms. To recover your physical health, it's important to first free your nerves from this compression. You apply the Vital Reactor's probe to the interrupter's maximum point or pressure spot to stimulate the interrupters that can be found here and there on the head and spinal cord, using the smallest physical stimulation possible. However, Vital React therapy does not directly correct the bone's position, but rather guides the bone structure to correct itself with the body's natural healing power.
So this is not equipment that directly corrects the bones.
Right. With the probe, you can measure the resonance frequency of the region to be treated and apply impact softly to release bones that have become rigid. This is exactly what the Vital Reactor does. Once the rigidity of the bones has been released, your natural healing power reverts your spinal column back to its normal position. For treatment of the brain, you apply the probe to the head in order to provide the appropriate stimulation at a wavelength selected by the computer. The vital reactor does not correct the bones, but rather guides the bone structure to correct itself using its natural healing power. After the procedure, we take an X-ray and dermothermograph to verify whether the spinal column has returned to its normal position. A post-therapy check is also important to ensure the proper outcome for the procedure. After vital reactor therapy, a mirror check and a MASA test are again conducted to see what improvements have been made. Vital React Therapy is a remarkable and effective procedure that follows scientific principles. An X-ray taken after vital reactor therapy shows how the spinal column has returned to its normal position.
So, is a single treatment enough?
No. What the first treatment does is simply like having you stand from a kneeling position to release your nerves from compression. Just imagine what happens when you suddenly try to rise after kneeling on the floor for a long time. Even when your nerves are freed from compression and blood begins to circulate, the paralysis in your legs doesn't go away immediately. Instead, you suddenly feel a temporary acute pain in your legs, which had been numb before and didn't feel anything. This is a process of change.
Some patients may erroneously believe that one treatment is enough if they don't really understand vital react therapy.
You're right. Of course, one treatment can help your problem significantly, but it usually takes a long time until recovery, because the nerves had been subjected to compression for a long time. I want people to understand that regaining the normal sensation of pain is simply the first step to recovery. In addition to the spinal column procedure, Vital React Therapy also deals with the ligaments and muscles that were hurt and the joints that were affected, in order to guide them to a complete cure. Please understand that this therapy is the very first step in the process.
Indeed, seeing is believing. Now, let's look at some of the cases where vital react therapy has relieved symptoms.
A woman crashed into a utility pole while driving. Seriously injured, she fell into a coma, leaving her with a speech disorder and the left side of her body paralyzed. Following vital react therapy, she found it easier to walk and began speaking with clarity. A housewife was plagued with headaches, dizziness, and fatigue. In crowded places, she repeatedly vomited and was diagnosed by a doctor as suffering from Meniere's disease. However, all of these symptoms disappeared after vital react therapy. A gentleman injured his lower back when he fell on some steps in his 30s. When he reached the age of 60, he began to feel acute pain in his lower back. After therapy, however, he is now well enough to ride a bicycle. A gentleman fell from a truck, injuring his coccyx and developing a cervical vertebrae hernia. However, he has not been bothered by that problem since therapy. Many others like them have also been freed from unpleasant symptoms, all thanks to Vital React Therapy. Vital React Therapy doesn't work miracles. It simply draws on the natural healing power that every person is born with. a therapy that causes your vital power to react and guide your body back to health. That's what Vital React therapy is all about.